Hello, everybody. Welcome back to the Immortalist. This is the voice in our quest to live free and to live forever. I'm excited to be here, and as I mentioned in the first episode, I was working on getting the studio back in order. This is the banner I was talking about. Super cool, right? So, getting right down to business. This is not an episode 2, this is kind of just a supplemental video. From the first episode, the interview with Wallace Hamilton. Um, who is the project lead for the network state project Immortalis, which is eventually going to become its own sovereign country. A lot of cool details there. I'm kind of going to touch a little bit on that actually in this video. For more information, though, there's a few links that you can click in the details of this video. What I wanted to talk about, though, is a question that someone put in the comments on that first episode. And the question was, I'm going to post it on the screen here somewhere, but I'm going to read it for myself, just so you know exactly what it is. I want to completely rejuvenate myself and live forever. How can I do that? And I think that's a really good question to go into. It goes back to basics and really is going to help us narrow things down to really be able to focus and make something happen. So if you're sitting there and thinking, okay, so I'm expecting an answer like if you breathe in this right way and meditate, and over the course of 20 years of that and eating only the certain type of food and partaking in one herb or another and doing different things, that's not where this answer is going. The approach we take here is based in reality. We've heard stories of maybe there's some gurus in the Himalayas that can do certain things spiritually and actually live forever. Has that actually been proven quantifiably? I don't know. As far as I know, I don't think so. But I really just don't know. But even if that is true, that's not so available to everybody. That's not a whole lot of people have you know the drive really to have that kind of spiritual quest in life to have a total tunnel vision to go into the Himalayas and to do that kind of thing. So what we're looking for is a more reality based approach. How everyone, should they choose to, live forever. And I don't have a magic pill or something like that. So, sorry about your luck there. What I do have is a step that all of us can take and a step that's necessary in this quest for commercial biological immortality that I think is so crucial it was worth making this video in response to this person's question. And the answer is, if we're going to make the question easier, how can I be immortal for real? And the answer is we need to free the geniuses of society. We need to free the scientists and the researchers who are working on this so that way they can work faster than they can now. Right now, there's a lot of regulation everywhere in the world. It's really rampant in the United States. But there's so much regulation that it holds back progress, particularly in this area of health and longevity, but really across most areas of industry and innovation. So, yeah, and a good example of this in the episode 1, I was talking with Wallace, and I brought up that I was at Radfest in September in Anaheim, California, and somebody was on stage talking about how they had gone through all the proper trials. They did just the scientific testing, and then they went to animal testing and did all the proper things, and then presented to the agency they needed to present to all their evidence that they were ready for human trial. And hoping for the green light because they did all the things they were supposed to do. And they were told by this agency, no, actually, we want you to go back to do more animal testing, and we want you to do testing that is the equivalent of spending $10 million more, which they didn't have because because of so much regulation, there's not a lot of investors willing to put that kind of capital into research because it gets so delayed. The return on investment is so far out there, and not even a likely chance that there's not a lot of capital going into this research. So the projects like that kind of just die, and it's because of regulation. And another story in going on in the world right now that I've heard about, that was mentioned in the Network State event that was in Singapore recently, is there's a network state project called Prospera. I think it's the biggest, and if it's not, it's one of the biggest network state projects in the world right now. And they had an agreement with Honduras that they were going to have their own land set aside and essentially be autonomous to do their thing. And from the start of it until fairly recently, it worked really well. They were able to come up with certain protocols and things in 6 months that otherwise would have taken 10 years to do. So it's showing some substantial, serious promise in the area of longevity and just the future of societal living. It was a really great project. But Honduras, since then, has backed out of the agreement basically, and tried to say, actually, the agreement we made with you is unconstitutional. We can't do it. So we're going to end the agreement, even though it's working out for both of us. We're just, no, we're not going to do it. And so now the whole Prospera project is being sent back. It's being taken for a loop. It has to pretty much restart again because the agreement they had with Honduras is null and void now for no good reason other than regulation and governmental agencies decided to back out. So some people are saying, and I heard this at Radfest, and I've heard it in many other places over the last few years that I've been kind of watching this longevity field, that, oh, we're 3 to 5 years away from discovering a cure, or 5 to 10 years away from actually having a viable cure to aging and death and being able to slow down and stop the aging process. Or some people say by this year, 2030, we will reach the point of longevity escape velocity. Or by 2045, we will reach the point of singularity with artificial intelligence and things like that. And some of you know exactly what I'm talking about. You know who I'm quoting here. It's a couple different people. But what I want to point out is we've been 5 to 10 years away from a viable cure to aging and death, or a substantial leap in slowing down the aging process. We've been 5 to 10 years away from that since at least the 70s and 80s. I remember reading material that was written, I think it was the 1980s, where it was said with confidence, we will have the cure to aging and death. We will have immortality within the first quarter of the 21st century. But fast forward to today, here we are, 2024. Next year is 2025. That's the end of the first quarter of the 21st century, and we are still 5 to 10 years away from a cure. And it was pointed out to me by somebody that the reason for that is because of, he called it the loop, that is caused by overregulation, by people who uh, don't really want this type of progress. They like the status quo. Without going into a whole lot of detail there, they would prefer things to be as they are and not give everyone the opportunity to raise standard of living and to live forever and be prosperous and all these things that are possible for us now. We don't have to be living in this world as it is today, where you can all look around and see all types of issues. But it's because of this loop caused by overregulation, by people who want to hold back progress, that we've been 5 to 10 years away from a viable cure for the last 50 years. So how do we get out of that loop? How do we sidestep that and free these genius people, these scientists, these researchers who are trying as much as they can to discover these cures and these protocols and things to do to slow down the aging process? And like I said earlier, the answer is to free them to do it. But how do we free them? Prospera came really close. um, they were able to come up with certain things in 6 months that would have otherwise taken 10 years. The problem with that, or the challenge with that, is the agreement they had with the country they were trying to do that within backed out of the agreement, and now they can't keep going. So the answer is having a sovereign country, another country in the world with its own recognized sovereignty that creates its own laws, its own constitution, its own declaration, governs itself, and that self governance, that autonomy, that sovereignty is recognized by the rest of the entities around the world. And if we were to have that, then the governance or the constitution of that geological location, that country, could be based on the fundamental of protection only. And if that were to happen, then these researchers and scientists and companies who are biotech companies and all these people who are working on this could come there and be protected and not held back. They would be able to work on their research and do it at faster and faster speeds. We talked a little bit about this, Wallace and I, in the first episode. But they would be able to come up with things at faster and faster rate, and not just the longevity industry, but every industry. And in doing so, they would be able to come up with cures, and the cures wouldn't be squashed by regulatory agencies because regulatory agencies have no jurisdiction there. It's its own country. They can't come in from whatever country to this country and say, you can't do that because this country has sovereignty. They can do what they want. As long as it filters through that fundamental of protection, that prime law of protection only. And so if what they're doing, if the protocol they came up with is viable, is tested, quantifiable, that it increases lifespan and health span and is in all of those senses a good thing, then it's free to commercialize it, to refine it, make it better, and then send it through the assembly line, mass produce it, and send it around the world. And or just have it available if other countries want to say, no, you can't send it here, then just have it available and people can travel there and take advantage of whatever cure comes about because of that bubble of freedom and protection for these genius people, these people who are producing, and in the case of a cure to aging, creating such a value to the world that it has to happen. And that's the only way it's going to happen. We have to sidestep the regulation that is rampant all around the world. It's not just the United States. It's not just in Honduras. It's everywhere in varying degrees, but the regulation, the over-regulation is everywhere. So the only sidestep is to get outside of that, start a sovereign country. And that's why I'm really excited about having teamed up with Wallace Hamilton and the Immortalis project, because that's exactly what they're working towards. It's starting as a network state project to garner enthusiasm and interest in bringing people on board. And as it grows, eventually we're going to get some physical land and do whatever it takes to form a sovereign country. And that's the goal. That's what's going to happen. So for more information on that, there's probably going to be a link, if I can put it on the screen, joinimmortalis.com. If you want more information, you can go there. But that is exactly what we are doing. We're going to free these geniuses, the scientists, the researchers who are working on a cure to aging, so that way they can do it and actually have it done in 3 to 5 to 10 years, and not say that out of lip service but in 10, 15, 20 years, we're all still dying anyways. No, we really want to make it happen. And that's the step that we can all do. We can all support freeing these geniuses of society. That's what needs to happen. It's not let me be the one to create the pill. It's not let's all just meditate and by law of attraction we're going to change the laws of physics and we won't die anymore. You know, that's it's not realistic. Even if theoretically it's possible, I don't know, depending on your belief system, maybe theoretically it is possible. But it hasn't happened yet. So let's focus on something that's real that we can all do and take a part of. This isn't just an interest anymore. This is real. This is real life right now. Today, we are really, really close to having cures to aging. We just need to get out of regulation. We need to have more freedom. And with that freedom comes a cure to aging. With that freedom comes a wave of prosperity that people haven't experienced yet. The United States, when it was formed, had the closest analogy to this level of freedom and prosperity, but it didn't quite get it. And when that happens, it's going to change the whole world. And that's lofty thinking, so let's not even go there right now. Let's just focus on what is real right now. There are people in the world who, by their own research, by the research of their companies, the testing, and the trials, know they are close to being able to come up with a cure to aging if only they were free to pursue it without being in fear of being criminalized and thrown in prison, and without fear of can I find an investor to fund the rest of this trial so we can finish it and prove it and get it done, or without fear of the investor getting scared themselves and pulling their investment out. That's what's going on nowadays. That's the key reason we don't have the cure to aging now is because of overregulation. So if you want to focus on one thing in this battle to cure aging, it's this. Focus on helping these geniuses of society get to a place of freedom where they can freely pursue their research to save our lives. That's what I wanted to say here. Again, for more information on the Immortalis project, visit joinimmortalis.com and be sure to watch, like this video, subscribe to the channel, share it on all your social medias, and remember, write in your calendar or turn on the notifications on November 10th at 1 p.m. Pacific time, 4 p.m. Eastern time, will be episode 2 of the Immortalis podcast or show. I'm not sure what we're going to call it yet there. And there's going to be a live interview with James Stroll, who, as I said before, is an activist in the longevity field, has been since the 70s, has garnered a lot of support, has helped a lot of researchers and scientists and companies have more of a voice to the public and therefore garner more support themselves. So he's done a lot of great work for this movement to cure aging. So we're really excited to have him on and interview him live. That's on November 10th. Be watching for that, and I will see you there.